My name is Dr. Walter Tsou, and thank you for coming to our session on getting to single payer. I want to talk a little bit about, in general, the idea of how I think we might want to think about talking about single payer in an effort to get there. And then I'm joined today by my colleagues, Jerry Policoff, who in his other life actually works on assassination archives or something like this, but has been a member of the board at Healthcare for All Pennsylvania, and Chuck Pennacchio, Dr. Chuck Pennacchio, who is also the executive director of Healthcare for All Pennsylvania. So all of us are actually from Pennsylvania, and we've come up to New York to talk about our support for not only single payer, but our thoughts about how we think we should get there. So what I want to do is talk in general about the ideas or the framework about how I think we should talk about getting to single payer. Jerry's going to talk about media issues and marketing the ideas, and also maybe something about the Affordable Care Act and how that may give us opportunities to talk about single payer. And then Chuck's going to give us some specificity about why states should take leadership around the single payer issue. So let me start off with sort of some general comments, and I should say that it is our full intention to be interactive, particularly since we're a small group here, and we have an opportunity maybe to get your participation and thoughts about how we might approach some of these things. One of the great challenges that we have, and there's a handout I have that sort of outlines my talk, so it's right up here in the front. So if you guys want to take the handout, it really summarizes the points that I want to make. I have more of those, so I'll get some more. The first idea is the whole concept of the term single payer, because I have to say that when you talk to most audiences, they don't really know what you're talking about. In fact, sometimes they say, well, what about married people, you know? So the point here is that single payer is, however, known to the policy wonky type people. So if you talk to health policy audiences or you talk to politicians, they know what single payer is. But if you talk to the general public at large, they really don't know what you're talking about. And so one of our challenges actually is picking the right terms for the audiences that we speak to. And I think that the general concept of Medicare for all, and improved and expanded Medicare for all, or as Chuck likes to talk about, a one-payer system, is maybe a better and more appealing idea for the public at large. So Medicare has been around for 48 years. It is arguably the single most popular and well-accepted health care program in this country ever, and it's one that will be lasting for the rest of our lives. It is one that has huge public support, and the reason why that's important, I think, is because from a marketing perspective, it's better to take something that people have some familiarity with and talk about why we should expand it for everybody and improve it. If I'm talking to politicians and trying to convince them from a lobbyist perspective, I do talk about single payer. But I think that it's important for us to think about the audience that we're talking to, and one of the big problems is that if we're not sensitive to that, we're not even out of the box yet in terms of getting the attention of people. The second point that I want to make is that single payer, to the great giddiness and joy of the right wing, is something they have labeled as a radical left-wing concept. And here, dare I say, I'm at the left forum. I think that it's a huge mistake that we even tolerate or allow them to marginalize single payer as a sort of a left-wing radical idea. The truth is that it's a very mainstream, very centrist idea that we have with single payer. I tell my Republican friends that actually any of your proposals are actually not as Republican as my proposal as single payer, because under single payer, every Republican in this country would be covered. And under your Republican proposal, you would still leave millions of Republicans uninsured. So I think the point here is that that we have to be very cognizant of the fact that actually we don't accept the idea that this is a left-wing radical idea. It's a very mainstream centrist idea, one that actually is very appealing to the middle class of this country, and one that, dare I say, in the left form, is very actually supportive of very small businesses and is actually patriotic to support single payer, because in fact, one of the victims of the current healthcare system economically are small businesses, which arguably are part of the engine of economic engine of this country. And to believe for a second that small businesses like the current system is really misreading the tea leaves. I think most small businesses would gladly get out of the business of trying to pick the healthcare plan for their few employees, and would be much happier if they could just concentrate on doing their business and selling the widgets they're making. And I think it's actually an important point for us, which actually raises the next point I want to raise, which is something that we have not strategically taken advantage of in the single-payer movement. And that is that, in many ways, the business community is very much split on this whole issue of healthcare reform. So, for example, for large corporations, they do provide health insurance for their employees, but increasingly they cannot afford to do with this. And part of the reason why they cannot afford to provide health insurance employees is because of something called the three dirty words, retiree health benefits. Because for many large corporations, often who have unionized workforces, they have bargained and allowed and agreed to pay for a certain percentage of the retiree health benefits. And that sum, as healthcare costs rise, has turned out to be an astronomical sum of money. To put this in perspective, one corporation, General Motors, had a retiree health benefit in 1994 of $60 billion, not million, $60 billion, one corporation, General Motors. GM literally spent the last decade trying to get rid of their retiree health benefit obligations, and to the point that they finally had to declare bankruptcy in order to get rid of it, and they turned all the retiree health benefit obligations to their union, the UAW, which started something called Aviva, which nobody understands at all, and it's Aviva. It's called a Voluntary Employee Beneficiary Association, VEBA. You never hear about this. Only policy wonks know about this stuff. The truth is that it's a disaster, frankly, for the retirees of General Motors, because they're not going to get really the full health benefits that they were promised. But the point here is that healthcare costs are extremely expensive, and large corporations, if you want to talk to them about it, that's kind of like the inside word that gets them really agitated, is the retiree health benefit issues. Now they've sort of wised up, and they basically have dropped retiree health benefits. So increasingly, you're going to see many large corporations find ways to get rid of their retiree health benefit obligations and to simply not negotiate it for their retirees in the future. And what that really does, it means is that more and more of Americans who thought they were protected in their retirement years are going to find themselves unprotected. For small businesses, actually, they cannot afford health insurance in this country, even with all these tax credits that the Obama administration have put forward. The rules for, under the Affordable Care Act, for small businesses getting tax credits, it's arcane and it's incredibly complicated. It's like you have to pay your workers a certain wage below the average, and a certain number of employees have to be employed, and all this other stuff. It's really very complicated for most small businesses, to the point that they probably throw their hands up and say, look, I really don't want to do this, and I'd rather just tell me how much it is, and I'll pay that, and if you can get my employees covered, or I don't really want to be in this health insurance business at all. So the point here is that we in the single-payer movement have not taken advantage of the fact that the business community is totally schizophrenic and unhappy about how healthcare, which is arguably the second biggest expense for them after payroll, for their business. And we should take advantage of the fact that actually, if we can get the business community on our side and sort of flip them to see that it's actually cheaper for them and easier for them if they would just simply pay some taxes to fund health care, that it would be a better deal for large and small businesses in order to provide health insurance, and they can get back to the business of making cars or selling telephones or whatever they purport to do. Do you want to say something? Yeah.
I don't want to interrupt.
Okay. Well, let me finish my points that I wanted to say. There's another huge group out there, the unions, which right now have been actually very unhappy about what's going on, and actually right next door, they're having a big conference about unions and the Affordable Care Act. But to summarize, the basic point is that most unions actually have actually gotten many employers to contribute to their health and welfare funds. And under the Affordable Care Act, health and welfare funds were not considered a group that could be eligible for the subsidies in the marketplace, if that makes any sense. So the marketplace has these state health insurance exchanges. If you're really poor and you don't make a whole lot of money, you can get subsidized health care to help you pay for private insurance. Well, it turns out that if your employee, your health benefits are coming from your union, even though you may be still poor, you don't get any subsidies at all. So the Affordable Care Act essentially did not consider unions as part of their of how to provide subsidized care for their members. And the unions are very pissed about it, to the point there that they think that they are now at a competitive disadvantage, because these employers out there could actually pay their employees not a whole lot of money, and then they appeal to they get their health insurance through the health insurance marketplace. They get subsidized health care through that, and actually it turns out that then they can underbid the unions for providing for a project or something that they want to build or something like that. So the point that raises a whole point that the unions now are very pissed, actually, having and assets of many unions. So they're not happy either. And we're going to talk about how we might take the unions and start telling them that they would benefit also from a single-payer plan. Okay, a fifth point that I want to raise is the general appeal of bureaucracy versus simplicity. Because the rules on the Affordable Care Act is so stunningly complex that it would make your head spin. And why is that? It's largely because it is based on the private insurance marketplace. And private insurance has all kinds of crazy arcane rules. But just consider this simple aspect of the health insurance marketplace, and that is the subsidies themselves. So you yourself, you have a job, and you lose your job, and now you want to apply for the marketplace, which you can as a special exception, because if you lose your job, you can now apply under the marketplace to get health insurance. And now you ask for subsidized care. And you maybe after a month you qualify, you get it, and then a month later you get fired. They didn't like you, or you didn't pass probation or something. And so now you have to figure out how you're going to get your subsidies, to pay for your care. And then you get if you got a job, let's say you don't have subsidized care, and now you want to get subsidized care. And the point here is that people are going to flip in and out of jobs, and they're going to also flip in and out of these subsidies. And the churning behind that is extremely bureaucratic. It all gets reconciled on April 2015, when you have to file your taxes. Because at that point, they're going to determine what your income is. They're going to ask you, did you have health insurance? And they're going to know how much subsidies you got through the health insurance marketplace. And if it turns out, as many people are going to find, that they were getting subsidies and they actually didn't really qualify for subsidies because actually they had some income from their part-time jobs and so on, they're going to be asked to pay back those subsidies. And that amount of money could be easily thousands and thousands of dollars. So come 2015, I will tell you right now, the people are going to be, we're right now in the honeymoon period with the Affordable Care Act. But come 2015, when you file your taxes in April, you're going to find a lot of pissed off people when they find out that they either owe Uncle Sam a lot of money and have to give back their money, or they should have maybe actually had more benefits and they never realized they could have claimed for subsidies, et cetera, et cetera. The system is, that one aspect, I think, is immensely complicated. And there are so many other aspects about the employer mandate, about what small businesses, tax credits, all these other things, that it just makes your head spin. Single payer is just so much obviously simpler. It's beyond belief. You just basically pay your taxes and that's it. You're covered for the full benefits that everyone else in the country is eligible for. Okay, I want to raise the sixth point, which is around morality versus economics. It turns out that many of us strongly believe that health care is a human right, and that the moral issues alone, the fact that we had 50 million people without health insurance, is a compelling enough reason to actually get health insurance for this country. If I believed that the morality of having so many people without health insurance was the reason why we should actually pass health care reform, I think we would have done it long, long time ago. In '93, when Clinton first talked about the Clinton health care plan, we had 37 million people without health insurance. We added 13 million more people between the Clinton health plan and the Affordable Care Act. And it was finally maybe the last minute push with the private insurance industry agreeing that we're going to mandate everyone buying their product that got them to say, okay, we're going to solve this problem by passing the Affordable Care Act, and somehow or another that's going to still leave 30 million people without health insurance, which in any other country would be considered highly immoral. The point here is that it is not the morality in this country that convinces people to do something about health care reform, because we would have done it a long time ago. It's the economics that's going to convince people to do something about health care reform. It's the idea that maybe, just maybe, if we don't fix this health care system, we will bankrupt this country. That is going to change the equation. It turns out that right now, even as we speak, this country, who knows what the national debt is? Anybody know? $17 trillion. Is that stunning that we as a nation owe $17 trillion? That's like an unbelievable amount of money.
That's just the federal government.
That's just the federal government, yeah. So
We're not paying it back.
we're not.
Seriously, we're not going to pay it back.
But how did we get into this mess? Well, part of the reason why we're $17 trillion in debt, there aren't very many things that we as a government spend money on that are in the trillions of dollars. But one of them happens to be health care. Defense is one. If you go to war, you don't pay for it, which we've done many times. You're gonna be in debt. But if you actually have a healthcare system that's highly dysfunctional, that spends 40% more per capita on healthcare than any other country in the world, and you live in a global economy, and somehow or another you think you can spend and borrow all this money to prop up the Medicare, Medicaid, and VA systems, well, you're mistaken. You just can't do this. And that is one of the reasons, a huge reason why we are $17 trillion in debt. The thing that is perhaps even more disturbing is that if you look at the trend line over the next 50 years, and you look at Social Security, you look at discretionary spending for the federal government, none of them are reasons why we're going to increase this. They're basically plateaued. They're in fact, discretionary funding is actually going down. The only thing that is contributing to rising federal deficit in this country is healthcare costs. That's it. So even if we do not think for a moment that we've finished with healthcare reform, we've done the Affordable Care Act, that's it, let's go on and talk about something else. Guess what? You can't do it. Because the federal deficit alone is going to bankrupt this country, and the only thing that's doing it is rising healthcare costs. And unless we address that issue of rising healthcare costs, we will, be in trouble. So it's unsustainable where we are right now, and that economic issue, frankly, opens the doors for politicians. It's the issue that I think they have to think about as part of the future generations of this country, this corporation, and the posterity of this nation, that we are handing our children a $17 trillion debt that we've created, and we're asking them to dig out, which I personally think is grossly unfair. We cannot leave our kids a healthcare system that is as much of a mess as it is right now. It is totally unfair to our kids and our grandchildren. And the truth is that unless we fix this and we provide them a system that works better, we have done them a huge disservice, and we've done this country a huge disservice. Now, I've outlined in my mind some of the major arguments of why single payer is the right solution. I mean, if logic alone prevailed, if morality prevailed, we would have done single payer a long time ago, right? So why aren't we there yet? Well, part of the reason is because we have the fear of the unknown. If we actually had at least a state that had done single payer somewhere that we can point to, and although we have many countries that actually have done single payer and have successfully demonstrated they can control healthcare costs, the fact is that most Americans are geographically deficient, and they could not actually find probably Washington, D.C. on a U.S. map, not to mention another country on the globe. So they don't know about Canada or Taiwan or what other people in Europe have done. And so they have no experience as to single payer, and so there's this huge fear of the unknown that's out there. All they do, actually, is hear media reports about some government programs, like the VA. It is not an accident in my mind that right now we are hearing all these terrible things about VA health care. And it's a perfect example of how the right wing will exploit this as a way of saying, look, the government can't do anything right, they can't do health care right, and we shouldn't support them. I mean, the fact that they have maybe a 3-month waiting period for a primary care doctor at the VA is bad in Phoenix, I agree. But the truth is try to find even in the private sector right now, try to find an appointment for an endocrinologist if you have diabetes, or a rheumatologist, or in my city health centers in Philadelphia, there's a 9-month waiting period for a primary care doctor in our safety net health clinics. So I'm telling you that it's all over this country that we have these long waiting periods. The difference between us and Canada is that Canada publishes it on their website, and we hide it underneath the rug and try to pretend that it doesn't exist. Of course it exists, and it's terrible. The other thing is that there's no funds to market the idea of single payer. So if we had actually the types of billions of dollars that Procter & Gamble has to promote their new products, et cetera, we would actually, I think we would have had single payer a long time ago, because the logic and the arguments around single payer make so much great sense. And then finally is the Citizens United stuff that has happened, where all the money has now gone to support these special interests, and in this case, the insurance and the pharmaceutical industry spent for the Affordable Care Act, one bill. How much money, anybody know? How much money was spent to pass the ACA lobbying?
Was it $4 billion or something?
Not that much, but $1.2 billion was spent for one bill. $1.2 billion was spent lobbying for the Affordable Care Act because they wanted to shape it in the way that was favorable to them. So they limited how much discounts they had to do for pharmaceuticals, and they forced us as a nation to buy private health insurance as the only option. They eliminated the public option as a possible choice, so they had no competition. The only choice you have in America now is you have to buy for-profit health insurance. And they paid all that money to Congress in order to assure that over the next decade, they have this enormous gravy train of revenue coming into their pockets. So all I can say is that unless there is a huge grassroots support and people wake up about what's really happening to healthcare in this country, we will continue I think, corrupt and irrational healthcare system. And one of the ways I think that perhaps we could change that is, in fact, thinking about a grassroots, a media campaign, and a way of starting changing people's attitudes about why actually in this situation a Medicare for All program for this nation would be a better program than what we have gotten with the ACA. I'm going to stop there, and I'm going to turn it over to Jerry and ask him to make some comments.
I want you to think about some of the things you just heard, many of which you probably didn't know about. And, and one of the other things you probably don't know about is that the Affordable Care Act as it exists today bears very little resemblance to the Affordable Care Act that passed Congress. And I will tell you very honestly, I was not a fan of that act. I know there are many people it helps. I was just having a discussion with somebody in the audience who has been helped by it, and it's wonderful that it helps some people, but there are many people. Can you hear me now? Okay.
That's for the TV. That doesn't.
Okay. Oh, all right. But one of the problems is that there are a lot of problems with the Affordable Care Act, many of which have evolved through decisions that have been made by HHS and the IRS and the White House, most of which have evolved in a way that favors the pharmaceutical industry and the health insurance companies and get very little attention in the media. So I'm going to talk a little bit about the media and why that is, but I just want to let you know about a few other things that you really probably didn't know about, and you should. And I think if everybody knew about all these things, I hate to sound like a teabagger because I'm a progressive Democrat and I have been all my life, but I have real issues with the Affordable Care Act. And just an example, all over the media you hear about how wonderful it is, 8 million people signed up for the exchanges. If you could look back at the original CBO report, you will see that they projected that 8.1 million people, I think, would sign up for the Affordable Care Act for the exchanges, and now we're told we did it. But if you also look back at the original CBO report, you would see of that 8.1 million people, 8.1 million of those people were to have been previously uninsured. The whole purpose of the exchanges in the Affordable Care Act was to insure people that were uninsured. If you had insurance, you weren't even eligible for the exchanges. And then all of a sudden, people left and right found their policies being canceled. The bottom line is, of that 8 million that have signed up, roughly, we don't know for sure, we can only tell from polls and the few states that are keeping accurate records, but roughly 20% of those didn't pay their premiums, so that's a little over 1.5 million that you have to deduct from that 8.1 million. And according to almost every poll that's been taken, every statistic that's come out from the various states, 2/3 of the people that have signed up for the Affordable Care Act are people who were previously insured. These are people that lost their insurance. It's good. When the smoke clears, about 1.5 million, maybe 2 million at most, of that 8 million are going to end up being people that are uninsured. That's what the bill was for. The bill was to insure people that didn't have insurance. So you can't call it a success even by the numbers, and nobody in the media talks about that. The purpose of the health care bill was to not necessarily reverse the cost of health care, but to slow it down. The latest CBO estimate is that by the year 2020, healthcare is going to represent 20% of our gross domestic product, up from 17 2 years ago, I think 18% now. It wasn't very well noticed, but in the fourth quarter, healthcare inflation was 5.6%, which was dramatically higher than it's been over the last few years because it's been slowing down. Even less noticed was, I didn't have a chance to get all of this on paper before I came up, so I'm talking from memory, but the numbers are close. In the first quarter, healthcare inflation was 8.6%, I believe. That's the highest inflation rate since 1996 for healthcare. I don't know if that's a trend line, and it's not being reported in the media, but that's not what the Affordable Care Act was supposed to do. And if that continues, even if it doesn't continue, the Affordable Care Act is unsustainable on that kind of a cost curve, even if those 2 quarters turn out to be glitches. I'm sorry, I just wanted to, one of the things that just came out, the insurance companies are now, they've been told that they can cap certain medical procedures. They can cap certain medical procedures. So, for example, if they decide that $10,000 is a fair rate for a knee replacement, and the hospital that you want to go to that is in your network charges $15,000, guess what? The $5,000 is your responsibility, and it doesn't count towards your caps. And I'll bet you guys didn't even know that. That's something very recent. And if you go out of network, it doesn't count towards your caps, and you're not covered. And these are all things that people need to know because they involve the problem of this bill. And this is where I want to segue into the media. We hear about the corporations that are supporting a system that really is not in their financial benefit. Chuck likes to say, follow the money. Today, we have, and there are leave-behinds on this, the top 10 global media owners, Google, Direct, they basically represent 90% of they control 90% of the media in this country. I did this presentation last year and the year before. The year before, I think Comcast was 9th on the list behind CBS. They're now 5th on the list, and if they're allowed to buy Time Warner, they're going to be 2nd. The public doesn't trust the media anymore. It's in the last report, or the last poll by Gallup, 55% of the American public didn't have much faith or any faith at all in the media, and 44% did trust the media. Since 2007, that line has been a much higher, generally by 10 to 15%, the gap between people that have faith in the media and those who don't, because people are figuring it out. And some of the things I just mentioned are, why don't we know about these things? And we need to know about these things. And there was a slight recovery in the most recent poll, but not really very much. Thanks to media consolidation, 6 media companies now control 90% of the American media, and the consolidation continues, as you know, with Comcast last year buying NBC. Originally, they bought half of NBC, and then they bought the other half. They're now trying to buy Time Warner. And the other problem that goes with this is the incestuous nature of these corporation boards. Walter was talking about General Electric. General Electric, in 2010, their revenues were $157 billion. When you look at the media companies that they controlled, Reuters, CTV Global, Canadian Broadcasting, Verizon Communications, Finance, Royal Bank of Canada, many financial institutions, institutions of higher learning. These are people that go back and forth between the various boards, people that are on their boards that are also on the boards of other industries. Harvard Graduate School, School of Business, University of Chicago, Massachusetts Institute of Technology, Healthcare and Pharmaceuticals, huge lists on Kettering Hospital, Merck, Unilever, Novartis, New York Presbyterian Hospital, Fortune 500 companies, Walmart, Microsoft, Xerox. I think you get the gist, but it's even, I mean, going across foundations, the Gates Foundation, the Rockefeller Foundation, Culture, the American Museum of Natural History, and many more that I won't even mention because I don't want to talk too long. They go back and forth between government commissions, the Business Council, the World Economic Forum Foundation, Ogilvy.
How it affects single payer.
Yeah, what I'm saying is it affects single payer because the message is controlled by media companies with incestuous boards of directors, and they control the message and they follow the money. And I'm not really sure how we deal with that, but we've got to get the word out, and I think the public is realizing it. I think you see it with the trend line in trust of the media. But I think we forget about the fact that we know far too little about our healthcare system because the media doesn't tell us. And they don't tell us because they really are part of what's now become what we've become accustomed to calling the 1%. And we really have to set up networks, as was suggested here. And the internet helps, but we've got a message that we need to get out, and people need to realize that the Affordable Care Act is not the answer. We have to get to single payer, and we have to overcome the fact that the media tries to keep the message from us in terms of what the problems really are. And I'll just defer to questions later to go on with this.
All right. Thanks, Walter, and thanks, Jerry, and thanks, folks, for showing up today. My name's Chuck Pennacchio, and I'm Executive Director of Healthcare for All Pennsylvania, and I'm one of the co-founders of what's called the One Payer States Network. We're a network of 26 state-based single-payer legislative campaigns. And that includes the likes of New York and Massachusetts, Maryland, Pennsylvania, Illinois, California, Hawaii, Maine, a number of other states. What I want to share with you today is the good news, which is that the effort toward achieving single payer, while it has been blunted in Washington, D.C. for many of the reasons that Walter touched on and Jerry touched on, having to do with the money and the role of special interests. And what Walter was really describing is what he sometimes calls, and I call, the medical industrial complex, right? You're familiar with this term? It's the convergence of major medical industries, pharmaceutical, insurance, big hospitals, medical instrument manufacturers. What Jerry's talking about is what I call the media industrial complex, and that's the convergence, the consolidation of media voice representing the larger corporate world. And when you merge the media industrial complex with the medical industrial complex, with the prison industrial complex, with the sports industrial complex, with the agricultural industrial complex, I think you get the point. You add all this up, and it amounts to what I call the political industrial complex. And the political industrial complex This isn't open secret. This isn't any sort of a conspiracy. I think anybody who stops to think about it for just a couple of minutes realizes that who's doing the bidding here. I think one of the reference points that Jerry was coming to, many people have heard of ALEC, which is what the American Legislative Exchange Commission, and it's formally dissolved, but it hasn't gone away. It simply has taken on another shape, another form. And another element, I think, that's important for all of us to understand is the current direction and state of the two major political parties, the Democratic Party and the Republican Party. The mainstream media, or the corporate media, if you prefer, continues to define the Democratic Party as a liberal party, and the media continues to define the Republican Party as a conservative party. But what most Americans don't talk about, because it's not discussed in our classrooms, it's not discussed in the mainstream media, is the direction the Democratic Party in particular has gone since the late 1960s. And that is, the Democratic Party is now a neoliberal party, and the Republican Party is a neoconservative party. So if you're to think of liberal as left of center, conservative right of center, neoliberalism is now right of center, and neoconservatism is extreme right of center. So we have really two corporate parties who are running our entire society from top to bottom. And that's why you see these pushes for austerity, for privatization, for anybody who listens to NPR or watches public television. I mean, it's just so thoroughly commercialized, I can't even believe it. And the way that they even discuss the problems in society, and they're very self-promoting about how deeply interested they are in getting into the truth. Well, I was talking earlier today, George Orwell, I'm going to paraphrase George Orwell here for a second, but George Orwell said the job of journalists is to investigate and to expose problems in society, is to expose the corruption of society, and everything else is public relations. Well, guess what? 95% of what we're getting is public relations. That's really actually what we're getting, if you stop and think about it. In Philadelphia, our local public radio affiliate runs a special program, a special section, it's called Pulse, and they focus on healthcare issues. Anybody in the room guess who the two major sponsors, or at least what industries they come from, the two major sponsors of this healthcare ostensibly investigative program are? Guess who sponsors them? Merck is, no, AstraZeneca, which is an international pharmaceutical, but you're on target. And the other major sponsor is insurance. In this case, Independence Blue Cross. Are you? Now, this is, people actually say this with a straight face. This is an investigative program on NPR, which is public radio, that is financed by the two of the largest insurance and pharmaceutical powers in our region. And that's not, it couldn't be any more blatant, right? I mean, this is, again, these are not, there's just no conspiracy theory here. This is in your face. And yet, when it's discussed, when these programs are discussed, people say with a straight face on the program, right, those who represent the program, that they're actually investigative and they're actually looking at serious issues. In fact, they're not, and that's the problem.
Tried to get a job in journalism lately?
Have I? No, I have not. I think that it's got to be a challenge if you have any integrity.
It's pretty grim.
Yeah,
And
yeah.
there are no jobs.
Yeah, well, Izzy Stone, I.F. Stone was my last great hero in the field of journalism. Right, right. Now, Walter's asked me to speak to single payer at the state level, since I'm Executive Director of Healthcare for All Pennsylvania and part of this group of other state efforts. And I want to just underscore for a moment what Walter had to say. I just like to boil down and compliment my colleagues on the panel here. It's really what Walter was saying is that single payer is a centrist solution. It's publicly funded and privately delivered. That's pretty simply in the middle, right? An idea of the left, public funding, an idea of the right, which is choice. You get to have your choice of doctor, hospital, and so forth. That's what single payer is. Let's not make it anything more complicated than that. It is fiscally conservative. in that it streamlines out the administrative costs of health care, which amount to 30 to 35%. That's how much is layered on by the insurance industry and then has to be met on the bureaucratic side by the providers. Hugely, hugely wasteful. And until we recoup those dollars, we'll never be able to finance universal health care in this country. Never. Never, ever be able to do that. And additionally, what Walter was talking about is that single payer is pro-business, pro-labor, pro-patient, pro-provider, and pro-patient-provider relationship, allowing the decision-making in healthcare to be restored to the patient and the provider. It's pro-democracy in that it gives people access to a fundamental need. Now, we can call it a human right, as I do, and we need to continue to push that notion. In fact, if you go back to 1948, the lead author of the UN Declaration of Human Rights was which country? The United States. Eleanor Roosevelt, if you know your history here, was championing this effort to establish healthcare as a human right, and the United States was leading that charge in 1948. And that was also the year, by the way, that Harry Truman unveiled his Fair Deal, which included universal healthcare. He picked up that charge from FDR, whose speech in January, his State of the Union address in 1944 was about economic human rights, about economic justice. So we have a history in this country of pronouncement. We have a history of speaking to these needs, of a history of identifying these as rights, and these are the brighter moments in our society. And yet, where we've gone toward our own people, the way that we've left our own people behind. I teach a class around the year 1968, and in many ways 1968 is a high water mark, and it's also the beginning of a downslide in our country. If you look at the world globally, if you look at the world domestically, it was a year that some people think was potentially a revolutionary year, a year of breakthrough in terms of basic fundamental civil rights and human rights. But if you look at 1968 is also the high water mark for unionization in this country, the high water mark for the earning capacity of Americans. 1968 was the last year that the United States was able to really lay claim to many of the pronouncements that we had declared coming out of World War II as an economic and global superpower. So turning to the question of state-based single payer, how many people in this room are aware that states are advocating legislation at the state level? 1, 2, 3, 4. Yeah, Vermont, right, is a good example, right? And in Pennsylvania, we're doing the same. In California and Hawaii, the other states that I touched on and that I mentioned before. New York is doing it, right? Well, New York's actually had a bill in the hopper for over, I think, 30 years, right? And it's being rejuvenated, it's being reactivated. I think there's a lot of good organizing around the New York State single-payer bill. But the question is, why state single-payer? Why push for single-payer legislation at the state level? And I want to just step back and clarify that everybody in the state-based movement does support national single-payer. I mean, I think it's important that people realize that if the opportunity was there in Washington, D.C. to get national single-payer, John Conyers' H.R. 676, we'd be all about that. I mean, we would be pouring every bit of an ounce of energy in there. But the fact is that Washington, D.C. is a cesspool of corporate cash. It's a cesspool of corporate interests. I think it's important to recognize that there are over 60,000 registered lobbyists in Washington, D.C. Registered lobbyists. Remember when Newt Gingrich ran for office and he was claiming he wasn't a lobbyist, and there was that whole discussion around him being an influence peddler, but was he a lobbyist? He never registered. We're talking about 60,000 registered lobbyists in Washington, D.C. who are paid an average of $375,000 a year to do the bidding of their corporate interests. That's Washington, D.C. So the reason that we take the fight to the state level is that there are many more opportunities. Many more opportunities. So that's the first point that I want to underscore is that if you get 26 states moving simultaneously on legislation, the chances are better that you're going to sort of divide and conquer, right, those special interests that would otherwise only concentrate on one power center, that being Washington, D.C. The second reason is what I mentioned at the top here is being one of the co-founders of the One Payer States Network, is that we do have a network of of leaders and activists and organizers who are constantly sharing ideas. So what works in Pennsylvania may work somewhere else, but it may not. What works in Vermont may work somewhere else, but it may not. But the point is we get to pick and choose so we don't have to reinvent the wheel all the time, right? So we get to learn from each other. So it's a very good network. It's like 26, if you will, laboratories of organizing around single payer and an opportunity to share ideas. So that's a very powerful mechanism for us. And by the way, one-payer states, we're not a registered organization. You're not going to read about us in the media. We have monthly conference calls, and we're having a conference in Oakland this year. In fact, we're going to be meeting in the same hotel as Labor for Single Payer, who have representatives next door, as well as Healthcare Now, which was based in New York for quite some time, and now it's down in Philadelphia. But the point is that networking is very important. Something else to recognize, and this speaks a little bit to Canada, because Canada's constitutional structure is very similar to the United States'. I don't know if folks realize this, but about 2/3 of the countries around the world have modeled their constitution after ours. And that means that their system, like ours, is a federalist constitution. Well, what is federalism? Simply put, federalism is shared power between the national government and the state governments. The point is that if you look at not only the Constitution of the United States, but if you look at the history of the United States, virtually every social, economic, and political reform has started at the state level. If you look at FDR's New Deal programs, he was rolling out those programs when he was governor of New York, before he got to Washington, D.C. If you look at the women's suffrage movement, the fight for women's voting rights, those efforts started out in the West. I mean, Montana, I think, or Wyoming, it was Montana. I think Montana was the first state to grant women the right, was it? Wyoming. It was Wyoming, okay. So I've got my mountain states mixed up here a little bit. But the point is that women got the right to vote at the state level before they got to the national level. If you look at wage laws, if you look at child labor laws, if you look at any number of reforms in our society, states are actually, on the positive side of the agenda, the place where experimentation, where ideas actually have to flower and succeed. I think Walter was making that point earlier as well. So marrying our Constitution and our history and using these models of examples. I mean, Canada, in fact, when they got single payer, they adopted it first in the province of Saskatchewan. Canada has, what, 19 provinces? Saskatchewan adopted single payer. Did I get that right?
10.
10? Why do I think 19? All right, 10. Just 10 provinces in Canada?
To include the northeast of the states.
Point, though, is that, all right, thank you. But at the provincial level, it was adopted, which is analogous to a state, right, Saskatchewan. Next, the single-payer movement is going to need to get Republican support. I mean, the reality is, in a state like Pennsylvania, but every other state, unless you're veto-proof, right, it's very difficult to get the House, the Senate in veto-proof margin, right, above 2/3 majority, plus a Democratic governor. Now, my good and dear friends in California said once Jerry Brown's elected governor, we're going to get single payer, right? Because single payer has passed the State House of California and the State Senate of California. So California's got single payer today, right? No, because Jerry Brown had his own agenda coming into office, and I'm not going to nitpick here, but the reality is getting a convergence of forces is very difficult. So you need to get some support from the Republican side. One of our outgoing presidents of Healthcare for All Pennsylvania, he was our president for 3 years, was a former Republican state legislator by the name of Dave Stile. And we've been able to reach deep into Republican ranks in Pennsylvania and getting them convinced that, yes, this is fiscally conservative. Yes, it's important to adopt these innovations at the state level. Yes, it's important to save our community hospitals. Yes, it's important to keep our doctors and nurses practicing in our state. Yes, it's important to bring down med-mal insurance. Yes, it's important to save our municipalities, our cities, our towns, our counties, and our state. And all of those attributes can only be delivered through single payer. You actually have a conversation with these people. The other thing that state single-payer advocates are doing is we're actually going to Congress because we need Congress to give us enabling legislation. Even though the Affordable Care Act allows state innovation as of January 2017, we need Congress also to allow the states to capture all of the federal health care dollars right? We currently pay taxes to Washington, D.C., and we recoup them in the form of Medicare, Medicaid, VA, CHIPS, government employee health benefits, and so forth. We need to capture those monies. One of the handouts that we have down front here has to do with an economic study that we did here in Pennsylvania, but we've done for any number of states. And that's to say that 40% of our funding depends on capturing those federal health care dollars. So that's a critical component as well. So we do need to get Republican support. Look, the U.S. House of Representatives is Republican. It's going to be Republican for the foreseeable future. Short of an earthquake, things are not going to change radically in 2014 or 2016. So you've got to appeal to Republicans, and the way that we frame and talk about single payer is very effective. It's very effective. And much as Republicans are up in arms over Obamacare, it's really funny to watch their expressions on their face when they realize, if they didn't already realize, that the Affordable Care Act, Obamacare, was a Heritage Foundation idea. It came out of a right-wing think tank in the 90s in response to Hillary Care. How many people knew that? A few of you did. Well, write it down. Obamacare, actually, it's a Heritage Foundation. This is a right-wing think tank. I mean, the fundamental premise of the Affordable Care Act is mandating people buy, as Walter said, as Jerry said, mandating people buy a private commodity, where the state is doing the business of corporate power. Now, where I grew up and the history I studied, that's called fascism. That's exactly what Mussolini was all about, right? State corporatism. Look it up. You know, you don't have to make this stuff up. It's just so weird, right? I mean, real life is so much stranger than fiction. All right. The next
I got
point.
to know Chuck when he ran against Bob Casey for the U.S. Senate. And it was speeches like that that made me a big admirer of this.
Well, I'm almost done here, and then we're going to have a conversation. And that is, again, adopting this two-prong approach, I think, is really important. And having conversations with Republicans is very important. I want to underscore that, and especially this election year. Because the great irony, of course, is that Obamacare was passed with only Democratic votes, and it's a Republican idea. Stop and think about that. And yet the Democratic House of Representatives, the U.S. House of Representatives, was lost over Obamacare. They lost their majority over Obamacare. They lost their majority over the Affordable Care Act. So having these conversations is only possible today with Republicans, at least in Washington, D.C. Democrats don't want to talk about it because they talk about all of the political capital that they expended to get the Affordable Care Act passed. They don't want to talk about it. So I think it's really important going forward to think about single payer at the state level, but also to think about single payer, as I think Walter and Jerry both began to frame the discussion, is to use the discussion not as promoting some sort of an ideology, as comforting as it is for people who identify themselves on the left, but to have the conversation more around methodology. What works? What is moral? What is going to save our society? If you start at that premise, if you start at that level, so, you know, the most right-wing legislative aide, and by the way, in Washington, D.C., the LAs, the legislative aides do not know what single payer is. They don't, because the only conversation they've had for the last several years is around the Affordable Care Act. They don't know what single payer is. I mean, John Conyers is heart and soul leader of the single payer legislative campaign, but outside of his office and the Congressional Progressive Caucus office of Keith Ellison and Raul Grijalva, you have to really dig deep to find a health care legislative aide who actually knows what single payer is. So you talk about ignorance, and I don't mean that in a nasty, pejorative way, but people who don't know what single payer is. The people who are paid to know what it is don't even know what it is. So we have a lot of education work in front of us. I think it's actually an opportunity, because you have these conversations fresh with people. And if the Republicans are critical of the Affordable Care Act, you push back and you say, what's your idea? We'll give you an idea that actually works, that is fiscally conservative, that can be launched at the state level, and it's a win-win for everybody. And frankly, most people are not going to lead on this issue. They're going to follow on this issue. So we get a leader in Pennsylvania in the Democratic State House and the Republican State Senate. We get them working together, and we're close to identifying those legislative leaders. Then we're golden. So I'll stop there.
I'd like to,
Can I ask a question?
Yes.
Yes.
Walter, you're,
a health care program for everybody.
It's the government is paying
Right.
for the service, medical services of the population.
Yeah, but that money then you as an individual can go to any private doctor, any private hospital for your care, similar to what the Medicare program gives you freedom of choice to.
And then how does the private insurance that we have now would come to the picture? Would they be abolished? Would we do away with them, or would they play some kind of a role?
Well, it could be in two ways. It could be that they are abolished if the single-payer plan is comprehensive enough that it would cover every healthcare need.
Yeah.
In Canada, there are some healthcare needs that are still within the domain of the private insurance companies. So if you want to get, I think, crutches, or you want to get a private room instead of a semi-private room, or if you want to get ambulance services, and maybe I think pharmaceutical drugs are covered through their
If you're rich, then
private
the link towards private insurance, you can afford it.
But in Canada, they don't allow the private insurance plans to duplicate what the national health insurance plan
They have to complement
cover. It has to complement it
Okay.
rather than duplicate it. And that's what we would think is a
Okay.
better solution.
yeah, and in Pennsylvania, the medical services and medical-related, health-related services are truly comprehensive. It's mental health, it's eyes, ears, it's the entire body, it's chiropractic, it's
Dental.
yeah, you name it. I mean, it is quite comprehensive. I think the way we envision insurance industry could play the administrative role, since they do have expertise in administration. But that beyond that, they're not illegal, but they can't be duplicative, as Walter said, and they're entirely marginalized. In Pennsylvania, the Blues control 86% of the market. Blue Cross Blue Shield, 86% of the market. And the Blues, as I think many people know, began with a public interest mission at the very center of their activity. They've lost that. I mean, they're corporate. Even though they're not for-profit, their money-making model is exactly mirrors Aetna, Cigna, and the for-profit industry. So where does that money go? It sits in big bank vaults across the state of Pennsylvania, and we need to recapture that money. That's more than $60 billion.
When it comes to the health of human beings, you don't want to put profit at the forefront
Right.
as the main focus.
Right.
That's too dangerous.
Absolutely. We have to get profit out of healthcare. Absolutely. Because otherwise it lends itself to corruption, and it's not stopped.
I have to add one thing, because I really think it is important, and it scales over a lot of this. Single payer is comprehensive universal health care. There are 34 advanced industrialized countries in the world there are 34 advanced industrialized countries. 33 of them have comprehensive universal health care. We're the only one that doesn't. But one of the things I actually meant to touch on before, when the Affordable Care Act was originally passed, it defined a minimum level of care, which we hear a lot about. And that was supposed to be designed after what the typical business healthcare plan was, an employer-provided healthcare plan. You probably all heard a month ago, 2 months ago, the CBO, the Congressional Budget Office, came out with this report, and the media talked about it, and my God, not only is Obamacare working, but it's coming in way under what was projected for it to cost. And so the CBO was projecting long-term that the cost would be significantly lower. Now, you've probably gathered I don't trust the media. So I read the CBO report, and I was absolutely flabbergasted, because there are things in that CBO report that I didn't see reported anywhere. And the main part of it that just floored me was that the reason the Affordable Care Act was coming in under budget, and the reason the projected costs long-term would be lowered, was because the standard definition of care that had originally gone into the estimates had been lowered by so much in terms of certain things no longer covered, certain caps, the smaller networks, that it was no longer the business model that they had believed would be the exchange system, that it was basically a much lower level of care. And because of that, the costs came in lower, and they lowered the long-term costs. And they were very clear that it wasn't, the main reason was because it wasn't the model of minimum care that was originally envisioned. And single payer it's comprehensive care. So it's just one more reason why we need it.
This gentleman's asking.
Yeah, I'm wondering if the people who oppose single payer are opposed it because it's for ideological reasons, because they're smart enough to look at the rest of the world and know it will work. And if we establish a governmental system for 17%, or now you said 20% of the economy, that could, we could look at another part of the economy that could be single payerized in something else. So it's more of it's not economic, it's all ideological, that they're afraid it will work. They don't want it to work. I don't know if you have a comment on that.
I think you're. I think that is a very big part, particularly among the corporations. So I'll give you this story that was told to me by the medical director of General Electric. So he said that this is in '93, and at that time there was the Clinton healthcare plan. Some of you remember, and Hillary Clinton had convinced this guy named Jack Welch, who was the head of GE, to come sit next to her at the congressional discussion about the Clinton healthcare plan, because she had convinced him to support the Clinton healthcare plan. And on the flight to Washington, as he was going there, he started thinking about what it would mean if General Electric sat next to Hillary Clinton and would agree that this would actually be a good idea. That he saw this as a slippery slope for corporations to actually endorse the idea that the government actually had an important role of providing financing for healthcare. So he ordered the plane to turn around and go back to GE headquarters, and he called back to Hillary and said, "I'm sorry, I can't sit with you." Now that, in a sense, illustrates your point that many corporations are afraid of that slippery slope, that in fact, if it was successful, they are afraid actually that it may lead to other things. But healthcare, frankly, I mean, the pharmaceutical companies will tell you the reason why they are opposed to it is because they want to have a choice of sellers for their products, so that if the Blues don't pay this price, then Aetna will pay a price, or Cigna will. They can go to a different marketplace of people who can pay for their drugs. And they are really actually afraid of the power of a single payer, because the single payer basically says, you want to sell this new hepatitis C drug for $84,000. We're not going to pay $84,000 to sell this hepatitis C cure. We help fund some of your research for NIH dollars, and we'll only pay you like $8,000 or $10,000 or something. Something reasonable instead of what they're actually charging. So it raises your point.
Yeah, I would agree with a lot of what Walter said and add even a couple more points. Economics is an important component here because of people's perceived economic interests, and people don't like to give up, as Walter put it, control. So the money and the control are really connected. There is a cultural element here as well, and that I guess that blurs into ideology some. But this notion of all people getting health care in the United States really smacks against how a lot of people perceive many pockets of America, including the poor and people of color and women. And it also brings into focus, I think, a little bit the questions of abortion. I think it brings into question just the role of pharmaceuticals globally, and I would raise the whole question of corporate welfare. I mean, if we move away from single payer, the gravy train for corporations, pharmaceuticals are massively subsidized in this country, massively subsidized. And I don't do this by anything other than habit. Is I have glaucoma, and I have to take 4 meds every day. I bring them along with me. It's good for visual. I've got a blue one, I've got an orange one, I've got a gray one, and I've got a green one. And these keep me from going blind in my right eye. I've lost sight in my left eye. I'm not looking for anybody's sympathy here, but it's $600 a month out of pocket on top of what I pay for insurance at my university. That's $600 a month cash out of pocket. That's, I estimated that I'm spending about 22% of my income. Now, my glaucoma got much worse after I took on this job of executive director, for which I am a volunteer, right? I'm not paid, so I wouldn't be able to pay for this. But the point is that the pharmaceutical industry has got a gravy-trained job. I mean, they got Medicare, was it Medicare Part D? I mean, that whole abomination of a vote that went down in, what was it, 2003, that was led by Billy Towson of Louisiana, who by tradition, Congress has votes. They have a voting window of 20 minutes, right? Members are supposed to vote within 20 minutes. If they're not on the Hill, they don't vote, right? They left that vote open for 3 hours so they could twist just enough arms to get the Medicare D legislation passed. And what they told some of the late, more conservative members is that this would only cost about $400 million. Well, the cost of the subsidies for the pharmaceutical industry since that time is over $3 trillion. So what I'm saying is that there's a massive amount of corporate welfare that's on the line, that's at stake. So they don't want to change the game at all. And for big business, I think Walter alluded to this some, is that the big businesses see the existing healthcare system, while costly, it also gives them a comparative advantage to smaller companies in the same industry, because they can weather the storm better. They can self-insure. They can absorb costs more so than can their competitors. So it actually gives them a relative leverage position in the healthcare economy over their competitors. It sounds kind of strange and odd, but it gives them relative competitiveness. Strange as that sounds.
Their system, and often have conversations with conservative people, people who identify as Tea Party people or arch conservative or whatever.
Always welcome them in their room.
And usually I have a panelist with me, like you guys, and there's been a number of interesting conversations that have come out of that. At one place, I had the former head of the teachers union in Cleveland and a lifelong auto worker with me, and this guy in the audience says, his wife was with him, and he says, we are what I would describe as ultra-conservative. And he just said, government cannot run anything. That was his sort of, and he was also a lifelong military guy who was in defense contracting, so that's kind of an interesting problem. But this very strange group went out to dinner afterwards, all those people, and his wife, who's the CEO of a company, she was talking to me, she said, Michael, your performance was very moving, we care, we just have a different idea. I said, well, what would you do? And she said, I would make all insurance companies and hospitals not-for-profit, and I would cap the administrative salaries at, let's say, $250,000, which I thought, geez, I mean, that's not my solution, but in some ways that sounds to me more...
Doesn't sound right-wing.
It sounds more progressive than the Affordable Care Act in some way, yeah? And then another guy, we played a sort of game like, okay, we're going to sit down and we're going to solve this and create something right here, yeah? And it wasn't, again, this isn't my plan, but my friend is extremely conservative. So the plan we came up with was he wants insurance to be sold across state lines. Yeah. And I said, okay, can it be sold on a federally regulated exchange where everyone gets it, the basic plan, everyone is guaranteed the plan. So basically by the end of this conversation, we had created the Swiss model of universal health care. Does that make sense? And you mentioned, there are 33 industrialized countries that have single payer. And a lot of times I think the single payer that we're talking about is, we're talking
Not
about.
necessarily a single payer, they have some form.
If
they have
yes,
some form
right,
of universal
okay,
health
yeah.
care.
So when we're talking about single payer, we're talking about Medicare, Canadian style, our own sort of improved version of that. But I think that there are Republicans who you could have a conversation with to create, not that we necessarily want to do that, but when you start to really describe some of those systems in other countries, that they would agree with those systems, like Germany too, yeah? And those things take away the terror that some people really have of government.
And those are mostly hybrid systems, by the way.
Yeah.
There's some form of the system we have combined with a single payer system or a socialist system. England has socialized medicine.
Yeah, absolutely.
And, but...
And that's not the one that you're going to win over your, legislators and wherever.
But there are lots, single payer is not the only way to get to universal health care. I think it's it's the best way.
Yeah.
But, you certainly, if they are, if they're so high and mighty about maintaining the free market, which we don't have, even though they use that term, there are many systems that we could emulate that do have a free market system combined with a single payer or a socialist or whatever system that manages to cover everybody.
The problem, just to finish there, for the United States, of course, is that so long as our Constitution is interpreted in such a way that insurance companies as corporations are regarded as people, and regulate the behavior of people and how much money they put into politics, then you can't really regulate those industries. That's the problem, I think, because politicians are bought. And in Germany, while there is a private insurance industry, they're capped at 5% profit. And they're happy to live with that. That's just their business model, and that's the way it is. And that's accepted across the whole of their society, right? But the idea of regulating the insurance industry in the United States under the current sort of political money system that we have right now is impossible. So that's why we prefer single payer. Administration official before a Cato Institute audience of Penn State law students. This is going back 4 or 5 years, and at the beginning of the evening, the vast majority of them were very hostile to single payer. By the end of the evening, not a single one opposed it. Now, a lot of them were neutralized at that point, but I thought that was a victory, and a lot had actually swung over in support. Because when you talk about state-based, when you talk about private choice, when you talk about efficiency, when you talk about streamlining bureaucracy, when you talk about returning decision-making, medical decision-making to the patient-provider relationship, bang! I mean, what conservative, seriously, should or would oppose that? They don't, and they won't. So it can actually be won, but it's important to keep at it.
Yes, you have to.
I think one of the problems in the single-payer movement is that a lot of our activists just are, I don't know why the hesitancy or why the unwillingness to have those conversations, but we have to have them. There's no question. And I'm glad that you've done what you've done, and keep at it, Michael.
It can be. Chuck and I have been in a lot of meetings with conservative Republicans, and these are people whose public rhetoric is not something any of us want to hear, but you sit down with them privately and you have a half-hour appointment. You end up still being in their office 3 hours later. And you don't walk out of the room with them saying, okay, I'm going to sign your bill, but they become your allies, and they tell you things that will, they basically tell you things that help you advance what you're trying to do, right, Chuck? And it's, so they're not really as hostile. Maybe they think they are, but you can sit down and I've had better conversations with a lot of Republicans than with Democrats. The woman that represented my district, I ended up running for her seat when she retired, and I did well, but I didn't win. She used to call me her favorite Democrat. Well, I'm a very left-wing progressive, and she's a very right-wing Republican. But we could sit down in a room and find a lot of areas of common interest. wasn't enough to get her to sign the bill, but you know what? When we had an economic impact study bill up where the legislature would pay for a study, she did sign on to that. And matter of fact, we had 68% of the Pennsylvania legislature, every Democrat and
48% of the Republicans.
yeah, 48% of the Republicans, I think, signed on to that.
Yeah, in the state Senate.
So it was safe because nobody, but there are areas of agreement, and we can't just assume that we can't talk to these people.
Our bill is quite compact. It's 26 pages. We've written it, revised it. It's been introduced every year since 2005, and it comprehends all necessary medical procedures in addition to transportation, medical transportation and care. In addition to, and our bill actually covers long-term care, which is really kind of an unknown because we don't know how our aging population's healthcare costs are going to roll out in the future, but we take it on. So it is truly comprehensive. The way that it works with the federal subsidies is that we're assuming, for purposes of our economic study, that we're going to be able to absorb all those federal dollars, including the Obamacare subsidies, Medicare, Medicaid, VA, CHIPS, Native American dollars, veterans dollars, all that stuff. Those federal dollars, I think, which you're referencing, those make up about 40% of the total pie of what's necessary to fund single payer. We also want to capture, and this is important for folks in New York and other states, is to think about all of the blues, the Blue Cross Blue Shields, the ostensibly nonprofits, who have what are called set-asides or emergency dollars they set aside because they charge people the same as corporations. Rather than paying dividends to their stockholders, they put money aside or they dump it into media campaigns and so forth. But we want to be able to capture all those dollars as well for the transition from the multi-payer current system to a single-payer system. So have I answered your question? Oh, right. Well, the other 60% is made up of a 3% personal income tax, which of course replaces what people are currently paying in the form of insurance premiums, copays, and deductibles. That goes away. You pay your 3% fair share personal income tax, and you're done. You're good. On all sources of income, by the way. Not just if you're employed, but if you get an unemployment check, you pay 3% of that. If you get a Social Security check, you pay 3% of that. We want everybody's skin in the game. We want everybody to pay what we consider to be a fair share of whatever source of income they've got. Now, that's the personal. In addition, and Walter referenced this earlier, I think, is businesses would pay a 10% payroll tax. Now, if you look at businesses that currently provide insurance, they're paying somewhere in the neighborhood of 20 to 25% of payroll for health insurance, those who provide health insurance. Those that don't provide health insurance, the McDonald's of the world, they're going to then have to step and pay 10% of business payroll. So that's the match, 3% personal income, 10% business payroll, plus the federal dollars that we're able to capture on the rebound from Washington, D.C. Does that make sense? So in Pennsylvania, it's about about $100 billion is what we're talking about. Currently, we raise and spend about $125 billion. So we're actually bringing down the cost of health care in Pennsylvania, but we're also going to be creating more jobs because a lot of the employees in the insurance industry will be displaced as a result of this. They will be. But they get a 2-year golden parachute, plus they get $25,000 in education stuff. All his business created jobs as a result of a healthcare system that is suddenly comprehensible, that businesses can actually plan for. They can actually make hiring decisions knowing what their healthcare costs are going to be 5 years from now. No company today can predict what their healthcare costs are going to be 5 years from now, let alone 3 years or even a year from now. So it makes I think it'll make Pennsylvania, as it will New York or any other state that adopts single payer, it'll make it the most attractive business climate in that entire region. And it will spread like wildfire. I'm absolutely convinced. Yeah. How does it come out? This is the additional cost for seniors, right, who have Medicare. Under Medicare Part D, the seniors have to pay, I don't know what the exact formula is, but have to pay a certain amount of money for their pharmaceutical drugs, right? That the government then subsidizes what they pay in order for the senior citizen on Medicare to take delivery of their pharmaceuticals. The government portion of that, since 2003, adds up to over $3 trillion. When the bill passed in 2003, this was under George W. Bush, the figure that was presented to members of Congress was that it would cost about $400 billion, right? So I mean, they grossly understated it in order to win conservatives over to support it and get enough votes for the bill to pass, if that makes sense.